Ataxia is the word used to describe the loss of control of body movements. It may affect our trunk, one side of the body, both legs, or a single limb. To understand ataxia, we need to consider problems affecting the vestibular system, cerebellum, and proprioceptive pathways. Problems within the vestibular system can cause disequilibrium and unsteadiness. If the problem is unilateral, the patient will develop profound vertigo with associated nausea and vomiting. Drugs and alcohol are the most common cause of this type of ataxia. Problems existing within the unilateral system can lead to Meniere's disease, a known inner ear disorder which leads to episodes of vertigo. The cerebellum is organized in a somatotopic distribution where the trunk is controlled centrally and the limbs laterally. The midline structure is known as the vermis. Lesions which affect the vermis result in truncated or gait ataxia, where patients may have a wide-based gait and appeared trunk. Lesions affecting the cerebellar hemispheres result in problems with voluntary limb movements. This is referred to as appendicular ataxia. Patients who are unable to maintain rhythm or amplitude of movement during rapid alternating movements demonstrate dystodiacokinesia. Finger-nose testing demonstrates these difficulties where patients have problems judging distance, known as dysmetria. The last part of the cerebellum is the vestibulocerebellum. Problems in this region result in postural instability and impaired eye movement control. Cerebellar ataxia can result from vascular lesions such as stroke, hemorrhage, demyelination, tumor, infections, hereditary disorders, and drugs or alcohol. When we discuss sensory ataxia, we are referring to problems associated with proprioception, where lesions affecting this pathway lead to an inability to stand with your eyes closed. This can be demonstrated through a Romberg test. The patient may walk heavily as they cannot determine where to place their feet. They may stumble when walking in the dark as they do not have access to visual input to assist them with their gait. This type of ataxia may be caused by inflammation, demyelination, vitamin deficiencies, infection, and inherited disorders.